Hi, I'm Veronica. I'm a resource nurse for the ICU, and we're going to go over the PCA setup and what it's supposed to look like here. So the main components is this is what will come up from pharmacy, and we'll have your drug listed here, PCA, and then in your packaging you will have this little guy here. You will take these yellow caps off and screw it into the bottom, like that, and then you're all good to go there. And then the next portion of this is you will want to prime. This is your PCA tubing. I like to clamp this first just in case. I'm going to remove this yellow portion off of here. I'm going to have a lower lock here. And then you'll remove the white piece there. And then these two go together. Then make sure that this is clamped down here, down at your Y site. This is where your primary tubing will come in. And then we are going to go ahead and unclamp here. And then we'll manually prime. And we'll want to make sure that we only manually prime to this Y site here. So we'll clamp again up here. Then I'm going to take our primary fluid. This is going to run at a continuous rate of 10, just a TKO. We already have this all primed and ready to go. We're going to remove this blue cap here. I'm going to unclamp that guy and pump for just a second. And we're going to finish priming our line. We're unclamped there. We're just going to prime all the way to the end. There we go. Okay, so the next step of this process is we're going to scan in the patient into Epic, and then we will scan our barcode of the PCA medication. And so we've already done that, and this is what your MAR is going to look like. It will say new syringe cartridge, the time and the date. We want to make sure that all of those are accurate. And then you will use 2 nurses to sign off, and we will be checking right medication, right patient, the correct loading dose, patient bolus dose, lockout interval, basal rate, and 4-hour dose limit. It's important that we go over that and that our settings here in the MAR match our settings on the pump as well. So it is a dual sign off. We'll scroll down to the bottom and then we'll hit accept. All right, so now we're at the part that we're going to load the syringe into the PCA pump. So when you first turn it on, it will ask if it's a new patient. You will select yes or no. You will need the keys to turn it on and to get the door open. The keys will not come out so long as the door is open. So this portion here, when you go to load the syringe, it is movable and adjustable. And that way, whenever you put the bottom of the syringe in, you'll load that first, and then you'll adjust this top part to the syringe. You'll also want to make sure that this barcode here lines up with the infrared scanner on the back of the PCA pump. If it does not line up, which I'll show you in a second, you will get an alert from the pump. So I'll ask you to rotate or raise the vial, and so you will just do a little rotation until that infrared light scans there, and then you'll have this come up. So our syringe is in good position. Sometimes if you are still getting those alarms, you could work on adjusting this little slide up here until it sits in there okay. So it's going to ask you to confirm that this is the correct drug that you're giving, and it is. We're doing hydromorphine 0.2 milligrams per mil, so we're going to confirm. And then we are going to top one, and then we're going to put in all of our orders here. The first one it's going to ask us for a loading dose. And then our loading dose is 0.4. We're going to hit enter. And it will give you the option to deliver that loading dose now. If that's something that the provider would like, you could do that. But for right now, we're going to deliver later. And we're going to continue on our setup. For our orders, we're doing a PCA and continuous because we do have a basal rate ordered. So we're going to select that one. It's asking for the PCA dose, which is 0.2. Enter. And then the lockout interval, ours was 6 minutes. And then this is the continuous rate, so our basal rate, it's going to be 0.2 milligrams per hour. And then the 4-hour dose limit, which was 6. And enter. I'm going to come up to this screen here. This is an excellent screen to bring up whenever you're doing your cosigns to make sure you look at your dose, lockout, continuous rate, 4-hour limit to make sure that that all matches your order, and then you'll hit confirm. And then this screen asks again if you would like your loading dose now. We're just going to hit cancel. And then it prompts you to close and lock the door. And then you'll push in and twist the key out, and then you will press start to begin. During your I's and O's, we're going to make sure that we check the history of the PCA, and this should be done prior to clear shift so that you can get your data points on partial doses, completed doses, and attempted doses. So you're going to go to history. And it will say press history or enter button to scroll through history. Press history again. This first screen is all of your settings here. We're going to hit enter. And this one is going to be the delivered, but we're going to go to, this is going to be the summary of the last hour. But for the complete shift, we're going to hit enter one more time. And it's going to give you the last 24 hours. Now, when you do the clear shift, all of this should reset. So if it's the last 24 hours, that's okay. It's going to be just recording your shift. And you'll want to record the completed, partial, and denied. All right, so we're going to show you how to do a clear shift total at the end of every shift. This goes into your I's and O's, and it allows you to determine how much the patient has dosage the patient has been receiving throughout the shift. So you're going to obtain the keys. You're going to, it will automatically pause as soon as you insert the key, and then it will say clear shift. And you'll press this button here. Make sure you look at the dose delivered, 0.2, clear shift totals, yes. And then that's what you will record 0.2 as your dose delivered. It will still show that it's paused. We will close the door and remove the key, and then we'll press start. And then it will resume. So after you have set up your PCA pump, you'll want to make sure that you hand the patient their button. It is important that only patients who are alert and oriented ×4 utilize the PCA pump. So we'll hand it to them and we'll let them know that they're the only ones that are to be pressing the button for acute pain management. Thank you guys so much for watching. If you do have any further questions about PCA pumps, administration, or setup, please refer to the practice alert that will be distributed shortly.